Hi, I'm Dr. Julie Marmon with ER Specialist Urgency Center. I've had lots of questions about strep throat lately. And here in Colorado, as in most places, when we're filming this video, we're headed into that fall-winter season where we're seeing a ton of strep throat, lots of other sore throats, lots of coughs and colds and that sort of thing. The big question always arises as to who needs treatment, when do they need treatment, and at what point do you take your kid in to be seen, or as an adult, when do you go in to be seen? There are a lot of things that can cause sore throats. Allergies, if you have reflux or heartburn, that can cause a sore throat. Smoking or environmental triggers can also cause sore throat. So I'm really talking here about sore throat and fever. That's the miserable, I feel terrible, I have a fever, I have a headache, difficulty swallowing, you just don't want to do anything. So we're going to split it up between kind of under 21 and over 21. If you're under 21 and you have that sore throat, headachy, fevery feeling, you are more likely to have strep throat than is an adult with the same symptoms. We can still get viral sore throats as kids, but we just see strep throat more often. So we want to figure out what's strep and what isn't. So why does it matter? Well, strep throat is caused by a bacteria, but in general, it's going to be self-resolving. We only treat strep throat to prevent what we call strep-related illnesses down the road. You may have heard of something called acute rheumatic fever or rheumatic heart disease. We're so lucky we don't really see that anymore, but there are a lot of older people running around who didn't have their strep throat treated and they ended up with rheumatic heart disease, and later in life they got valve replacements in their heart. So that's kind of a big deal. Fortunately, we don't see that much anymore, but we still are looking for strep. We still want to treat it. So what do? If you come in with strep throat, we look for, or come in with any sore throat, we look for signs of strep. Do you have tonsillar exudates? It's a really fancy word for all those white spots on your tonsils. So when you look in someone's mouth and their tonsils are huge and they've got white spots, that could be strep throat. It could also be viral. We also look, are you tender right through here in the front of your neck? That's where your lymph nodes live, and they tend to get very tender with strep throat. We look for fever, and we also look for the absence of a cough. So those are 4 main criteria that we look for. If you have 3 of those, you should probably get a strep test. Once you get the strep test, we know to treat you with antibiotics, and everything's great. So as an adult, let's talk about you guys over 18 to 21. Only about 5 to 15% of adults get strep throat, which seems so little when you look that we actually treat 70% of adults with antibiotics. That is a ton of unnecessary antibiotics. And as you've probably heard, there's a lot of antibiotic resistance. So we're really trying hard to be responsible with our antibiotic usage. So what do? If we've talked about strep, if you have it, we treat you with antibiotics. If you don't have it, what do? How do we get you better? Well, there's a couple things we can consider. Number 1, we consider a single dose of steroids. It's called dexamethasone. It's one time, and it can cause significant improvement of symptoms in about 4 to 6 hours. Usually by about 48 hours, people are feeling much improved. We also recommend over-the-counter pain relievers and fever relievers, Tylenol, Motrin. You have to watch out if you have any other health problems and can't take those. And otherwise, lots of fluid, lots of rest. It's just going to take time to get over. If you have questions or concerns, or you think you have strep throat, come on in and see us. We'd be happy to take care of you.